All right, so today we're going to do something a little different. We're stepping back in time all the way to 1974 to look at a really important text, Dr. Silvano Arieti's interpretation of schizophrenia. We're going to see how psychiatrists back then wrestled with one of the biggest challenges in medicine, and honestly, what we can still learn from their way of thinking. So let's just dive right in.
So picture this. You're a detective, but your crime scene? Well, it's not a room. It's the human mind. And the clues, they're symptoms. But these clues are tricky. They can be confusing, they can contradict each other, and sometimes they point in a dozen different directions at once. This was the massive challenge facing doctors trying to make sense of serious mental illness.
So yeah, let's try to piece this whole diagnostic puzzle together. Because from this 1974 viewpoint, you're about to see that diagnosing something like schizophrenia was never, ever as simple as just checking off a few boxes. Now, Dr. Arieti starts off with something you might not expect. He says that for a typical case, making the diagnosis was actually pretty easy. For a doctor with a lot of experience, the pattern of symptoms could be just unmistakable. But the really important word there is, of course, typical.
Because here's the kicker. Most cases weren't typical at all. The real challenge, the thing that truly tested a clinician's skill, was navigating all those gray areas where the signs of schizophrenia could look an awful lot like something else entirely.
Arieti had a name for this group of lookalikes, the ill-defined group. And I mean, what a perfect description, right? You've got everything in here from latent cases and borderline conditions to serious personality disorders. This wasn't just a list, it was a genuine diagnostic fog, and doctors had to feel their way through it so carefully.
So how on earth did they do that? How did they cut through that fog? Well, a good psychiatrist needed a set of principles, kind of like rules of investigation. And it all started with one core rule about seeing the whole person, not just the pieces. And here is Arieti's fundamental rule. He said that even the most classic symptoms, things like hearing voices or having delusions, could not be seen as absolute proof. Why? Because those exact same signs could show up in other conditions. A single clue, no matter how convincing it seemed, was never enough to crack the case.
And this brings us to this really key idea, the Gestalt approach. Now, Gestalt is a German word that basically means a whole or a pattern. The whole point was to look at the entire constellation of symptoms, the big picture they create when you put them all together, instead of getting hung up on just one or two isolated signs. The detective had to see the whole pattern to really get what was going on.
A huge piece of this Gestalt approach was ruling out all those lookalikes we just talked about. A really skilled doctor had to be an expert at what's called differential diagnosis, basically eliminating all the other suspects to get to the truth. And believe me, the stakes for getting it right were incredibly high. Okay, look at this example of obsession, because it shows you just how subtle the differences could be. Arieti talks about a neurotic obsession, like a patient who fears the number 8 because a loved one died on that date. See how the fear is kind of contained? But in schizophrenia, that fear could spread like wildfire. Suddenly, it's not just the number 8. It's 18, it's 28, it's 800. And these numbers start to take on these bizarre, delusional meanings. The symptom starts to completely take over the patient's reality. And the stakes? Well, they just couldn't be higher. This is a really tragic case. It's about a patient who was hospitalized for 27 years, diagnosed with schizophrenia. But it was only after she passed away that an autopsy revealed the true cause of everything, a massive brain tumor. It's just this gut-wrenching reminder that physical diseases could perfectly mimic psychiatric ones.
All right, so once a really careful diagnosis was finally made, the investigation still wasn't over. It just shifted. The question changed from, what is this, to, okay, what's going to happen next? This is what's called the prognosis, the attempt to read the signs and predict the outcome.
And, the outlook wasn't always bleak. Not at all. Arieti pointed to this study from Finland that followed patients for 5 years after they were first admitted. And the data showed that social recovery was absolutely possible. In fact, it was common, with rates consistently over 50%. This was a huge deal because it flew in the face of the idea that a schizophrenia diagnosis was basically a life sentence.
So what were the signs of a better prognosis? What clues was a doctor looking for? Well, Dr. Arieti laid out a few. A sudden, really acute onset of the illness was actually seen as a good sign, especially if you could point to clear triggers, like losing a job or a bad breakup. And interestingly, the presence of anxiety or depression was also seen as a positive because it suggested the patient was still aware that something was wrong and was actively fighting it.
But then, on the flip side,
there were signs that pointed to a much more difficult road ahead. A person having a withdrawn or schizoid personality before they got sick was a concern. A defiant, uncooperative attitude was another one. And maybe the most worrying sign of all was the state of complete hopelessness, a total resignation to being sick, which kind of suggested that the fight was already over.
So, when we put all these pieces of the puzzle together, what's the big picture? What's the main thing we should take away from this look back at how diagnosis used to work?
It really forces us to ask this very fundamental question, doesn't it? What is a diagnosis actually for? Is its only purpose to stick a label on a set of symptoms, or is there something much deeper going on?
For Dr. Arietti, the answer was crystal clear. A diagnosis was never, ever the end of the story. It was the beginning. It was the starting point for understanding a person's entire life. The whole goal was to see past the symptoms and see the whole person, their history, their struggles, and their unique potential to get better.